There's no human-to-human transmission of hantavirus at this stage. Welcome to 5 Minute School. You may have heard in the news a man in China died from an infection with a virus known as hantavirus. Yes, you heard different. There is another virus on the agenda. So this virus originates from rodents like rats who are hosts to the virus. The virus is also contained inside the feces and urine of the rodent, even in the saliva. And if the virus becomes airborne, it can be inhaled by a human and result in infection. The virus can also enter through open wounds and also through bites. The symptoms of hantavirus include fever, muscle aches, which occur mainly in the large muscle groups, for example the thighs or the back. Fatigue is also a common symptom alongside nausea, diarrhea and abdominal pain. At a later stage, at around 4 to 10 days of infection, symptoms of hantavirus pulmonary syndrome may occur, which includes coughing, shortness of breath and fluid filling up the lungs. Hantavirus pulmonary syndrome has a fatality rate of around 40%. There's no vaccination or cure for hantavirus at this stage except for management of symptoms. Hospital admission early on results in a better prognosis for the patient because with the cases of difficulty in breathing and the lung issues that it causes, having access to oxygen and a ventilator really assists with the respiratory distress. There's no human-to-human transmission of hantavirus at this stage. The main passage of infection is breathing in the infected feces particles when they're floating around in the air, or rodent bites, and eating foods which are contaminated with rodent droppings. Those who are at risk of hantavirus are those who have infested houses, campers or people living near foresty areas, and those in close proximity to the rodent population in their day-to-day lives.